Where are you in the dental circle of life? Where are you on earth? Where are you in your dental journey? Such philosophical questions that I'm going to help you answer. My name is Dr. Nacho. I'm here with my good friend, Dr. Todd Fleischman. And oftentimes when I start these interviews, I start with the origin story, but I don't want to start with the origin story. I want to start with where are you now? Where are your feet? A very popular philosophical question. Be where your feet are. That's why I try to put my feet at Alves as much as possible. But Todd, tell us where are your feet right now? What are you doing as a practice owner? Give us just a right now version of what you're doing.
Yeah, hey guys, I am in my office. This is my actual private office in my dental office, which I was just talking to a buddy of mine, one of my closest friends, besides Paul Goodman, and I was just saying how this space is a very safe space for me. I really love my private office, and I have a south view, so I get tons of light, which you're pouring on me right now. And I actually don't mind being in here on an off day. I'm not seeing patients on Fridays.
Just go to your happy place, like Happy Gilmore, right? So that's where you are.
Happy place is a strong word, but I would say, comfortable place.
So share with us, being a practice owner, being a parent, sometimes people think it's all cute Halloween costumes and great pictures on Instagram. They don't see behind the scenes, right, Todd? So You're there today, but it doesn't look like you're doing dentistry. So why are you at your office today? That's weird.
No, I'm doing what the paperwork day, admin day. This is the day. I'm fortunate that the practice is busy, and during the week I really don't have a ton of time to do new patient chart notes and comprehensive notes like that, and just still pay my own bills and write my own checks. I think it's important. There's a couple of things I just do as like a small office owner that I also take it easy on Friday. I mean, trust, I didn't get in until 10. I had Pilates from 9 to 10. I go for lunch. It's a pretty lackadaisical day.
What you're telling us out there in the Nachos is being a practice owner, I can definitely palm a regular Eastern basketball. No one asking me questions about this, but this is Daphne's basketball. But during the week, Monday through Thursday, what you're sharing is there's not a lot of time to even work on your business because you're busy working in it. Is that a fair assessment?
Yeah, I mean, I am working in it, and your brother is a wise guy, and he and I talk often about decision fatigue, right? And so during the day, in the midst of our day, which is already blocked out and scheduled out, and I have a lot of things going on, it's hard for me to go from like Showtime dentist Todd to more administrative, thoughtful Todd, and so I try and separate them as much as I can, quite honestly.
Being a dentist, it's like being the star of a Broadway play that nobody wants to see or pay for. The opposite of Hamilton, right?
Yeah.
So Todd, this is where, we have all these people watching and learning, a bird's eye view, inside look at Todd. Tell us something. This is the two parts of dentistry, amazing and annoying. So share with us something amazing, awesome, good that happened this week, and also share with a challenge, an annoyance, a frustration.
Yeah, amazing. I mean, let's start there. We had a great team meeting. We had a team meeting Wednesday. You can actually see behind me on this board.
I love a good whiteboard.
Yeah, I learned from the best, aka Paul Goodman, and so we talked a lot this week about what describes our practice, things we want to be paying attention to, how to step up the game, and so we have some trigger words that sort of we wanted to all focus on and make sure we're on the same page. That was a real win for us this week. The team really gets engaged, and I enjoyed doing that exercise. And then I always just have personal wins with patients. I mean, I had a really lovely patient week. As this practice has grown over the past 10 years, the patients who we didn't see eye to eye on or philosophically were on the same page, they sort of worked their way out. Yeah. And now when I see most of my patients, they enjoy being here, which is really lovely, right? And so that makes working a lot easier. And so that's definitely a win for the week. That felt that way to me this week, that I saw patients who wanted to be seen, especially during COVID. These are patients who want to be here right now. And those are patients who should be rewarded for that and really need to understand from us that we're thankful for them being here. When I leave an operatory after a hygiene check, I say, thank you for their support.
Hold on. I have a hygiene check. So I have a good example. This is it. Hey, you, right? Looking for you to check hygiene. I turn this guy on how to turn him off. So Todd, I like Janet. So
do you have an off button?
I do not have an off. Yeah, thanks. The team wishes I had one. You said something this morning that was so appropriate. You said you were looking forward to this, I think, which is kind of everyone's experience with me doing anything.
No, I was kidding. Of course I was.
Let me give this out of the room for a second. But
throw that out the window.
What I wanted to ask you was team meetings. When did you incorporate that? Because some dentists say I don't have time for team meetings, or it's not worth the wasted productive time. Why are team meetings so important to the TAF team?
Yeah, those two statements are completely false, first of all. And second of all, I've been implementing it since day one. I was fortunate that my predecessor had great systems in place, which
Awesome.
set me up for extraordinary success. And then we just have perpetuated that attitude over the past 10 years. So we do a monthly meeting. I know some people do them weekly. I mean, I know some people do them every 2 weeks. We do them monthly. We have a morning huddle, of course, every day, but we do them monthly. And I think there's just nothing more important. It just gives everyone a chance to give feedback. Team members can talk about wants and wishes. We can talk about next steps and goals. We can talk about wins like we're doing now, what was annoying, how to manage patient expectations, whatever it may be.
And what I'll share, Todd, is I love all
it pays
that.
huge dividends, huge dividends.
The annoyances or the drop notches, are not always something you control. I'll share one from my life. I was there Tuesday and Wednesday. Both days, our practice management software, our workhorse, Dentrix, was down. When Dentrix goes down, for some reason, you feel like you can't even drill in a tooth when Dentrix is down, even though the two are unrelated. So that was an annoyance that I dealt with. What's a frustration or challenge that you dealt with? Might have been something totally out of your control, within your control. I think our audience would like to hear that.
Yeah, I mean, I think it's very common. My practice is just like everybody else's. Late cancellations, schedule changes. I mean, our practice works extraordinarily hard. My team is amazing. I have 3 incredible admin team members who spend half their day doing COVID screenings over the phone, making sure patients are going to be safe when they're here in the practice. And then when we go through all those efforts and patients cancel last minute, or they take a spot that's really a coveted spot right now in the practice, it's frustrating because I will say, even in my practice, it's definitely not as robust as it had been a year ago. And while we're continuing to ramp up slowly over time, and I imagine as vaccines come out and people feel more comfortable, that will help. But every appointment counts now, man. And that's just the reality of what we're doing. And it's not the same climate as it was a year ago. And so it's annoying. It's frustrating when you work very hard and you have your team members work very hard, and they're spending tons of time trying to get people in here safely, and then it's really sort of thought of as an afterthought for patients, where they forget, sleep late.
We had some of those. Ariel was working in our office this Wednesday because she wants to spend as much time with me as possible, like most people. Mary's on the call, her too. She gets experience that, and she sees stuff drops out of the schedule, and that is a frustration. Now, a couple of things I want to share. If you text TAF to this number, you can win one of the sweatshirts that we're wearing. Todd will autograph it.
This is an exclusive. I want to know. I want everyone to understand. These are friends and family only so far.
I like that.
But I did say to Doc Nacho that I'm happy to give one away because
I like that. You can be part of your autograph it. I like that, Todd. So we're going to get to ideas that I've given you that you love. It's a long list, but not yet. Before we do this, I want you to share. So Super Dentist Boost is coming up. You're going to be a speaker. You are also someone who I admire for taking so much CE over the years. Talk to me a little. What are you going to be talking about at Super Dentist Boost with Smile Transformations? And just tell us what you've learned through taking more virtual CE, both as a speaker and a participant.
Yeah, I mean, first of all, this opportunity for CE as people get close to licensure requirements is a huge opportunity. I was texting with a close friend yesterday. He's like, anyone know of anything online that's more than like a 2-hour course that can fulfill more requirements? And I was like, hello, like Nachos, you know what I mean?
For people watching, if you just text this number, your phone won't blow up. It's going to be 15 plus hours. And in PA, Todd, where we are, you have to take in-person CE for part of your requirements, and there is no in-person CE. But when you watch live from your couch and enter in a code while you're watching live, it counts as in-person CE. So
no, we're gonna talk about awesome cases. I mean, you guys know from the stuff I do before, I do all case stuff, right? It's all case presentation, which I like, and it's just showing my thought process as we take on these sort of challenging, either traumatic or cosmetic cases or combinations thereof. And so we're just going to look at a lot of pictures, talk about, workflow, talk about choices, talk about systems. The more I do this stuff, the more it becomes sort of like I'm an automaton, and I just go through the motions that I need to. I lost something right now. Oh, you're showing the case.
Yeah.
Yeah, I mean, this is a perfect example. I can show Donna. She's amazing. That was one of the best cases I've ever done. I mean, and these are the cases that are coming out of the office now, and I'm getting better and better as I get more and more experience. And so I like to share my journey too, because quite honestly, I'm a very honest practitioner, and the cases that I do now don't look the same as the cases that I did 10 years ago. There's no question about it. And I often worry that when we show these kind of results, people get kind of overwhelmed and And I just want everyone to understand that like it takes time to work toward these results, in my opinion. I'm always more impressed when I see people like Lewis or Miles or people that we know and we're close with that do these extraordinary cases early in their careers. And I'm impressed by it because it took me a lot longer to feel comfortable managing it.
I love that, Ton. I talk a lot about your dentist and core, your mind, words, and hands. These cases like this, just what skills do you use out of this to make this happen for a patient? Because I think a lot of times dentists say, if I can just learn to do the prep, but it's more than that, right? So what do you?
The prep is the easy, and I can teach people the prep, right? I mean, you can practice the prep. What you can't practice is developing the relationship it takes to have this patient do this treatment, right? At least in my hands. It's one thing when you are referred to a specialist and you're going for a site-specific thing, and I always tell my patients, whether you like the specialist or not, you don't have to be his best friend. I'm your best friend, right? You go to the specialist, you have what you need done, you come back to me, I'll take care of you, right?
Nice.
But when it's me doing things from start to finish, you have to develop that relationship, which I feel very strongly about. I also don't really love doing this kind of work on patients that I don't have a relationship with, because a lot of things can happen during this time period. They're in weird temporaries. They don't like the way the initial veneers look. I mean, this final picture on Donna, who's a beautiful woman, I tried a full set in first that she sent back.
Right. And that's what Lincoln Harris talked about. People don't always see the journey and things that go behind the scenes. I've learned from both of you guys how important relationships are. And I'm someone who's big into relationships, but whether it's an implant case, a cosmetic case, an ortho case, developing relationships on people to do high level dentistry. And that's something I did not appreciate as a new dentist myself. I thought, oh, if you just do it, you could do it, but the patient personality profile is important. And just if you like doing it, because you're going to see this patient a lot, and then you're going to see them when they come back for recalls. So I love sharing. So you're going to talk about smile transformations at this booth.
I just think it's important that young dentists understand, which is always my favorite people to talk to. I mean, I'm 42 now, so I would still consider myself a youngish dentist, but not so much anymore. But younger dentists, what they need to understand is every opportunity you have to interact with a patient counts, right? That's what it comes down to. And the reason why I'm doing these cases now is because 10 years ago, I started to talk about them with patients, right? I started to plant seeds. And so it's tough as an associate when you're in certain places and you don't know where you're going to be and you don't have roots down, and I get that. But every conversation does count. As far as what I'm planning on showing, I can show Donna, I can show Lon that we did over a CE recently, which is an incredible trauma case that you keep promoting, which is beautiful and I'm very proud of. I mean, I'm always open to any suggestions that people want to see. I mean, I would take feedback from your audience.
That's awesome. If you want to order,
what do you want me to show you?
Todd is a big music fan, so it's like you can request your own Todd song. But also, one of the things about the booth, and you see people speaking, Jason Smith and Artie Volker, all these people, you can interact.
I mean, can I interrupt you for a second? I mean, these guys, people talk about my ceramic stuff. That's because I work with great ceramics and I do good planning. I've been trained well through Spear and Coyce and my predecessors, and that's great. But you look at someone like Artie, right? I mean, these guys are next level practitioners. Jason, next level practitioners. The opportunity to learn from these guys in this forum amongst us normal dentists, I think is spectacular.
Like I said, and you can ask questions during this. You earn live seat. And I'm really trying to create, Todd, for this, because I'm a big fan of the new Dentist Boost Camp and the Dentist Team Boost. I'm trying to create the energy of everyone watching in live. It's not really about getting the recording and watching on your own time. It's about, this is our festival. This is our thing. Block out the time from your office, sit on your couch and watch this. Go on your Peloton and watch this. Walk around and watch this.
This is our community, right? Yeah. Like, we have an opportunity here to continue to build something amongst like-minded individuals who, as you often say, want to be here, right? This is a platform that you're incredibly courteous and generous to offer people. And if people want to subscribe to it and be a part of it, then I think it's really lovely, because this is a community where we want to share with each other. None of us think that we're God's gifts. We're not touring the country. We're not trying to push extraordinary things toward people. We're not being in your face about it. We just want to try and share this kind of information amongst like-minded individuals.
I love it. And also, Jeff Goodman's not here, so I can talk about him behind his back as being one of the best Peloton riders in the United States.
True story.
It's nice to go on your Peloton sometimes and just do it and be done, as opposed to traveling to it, parking your car, doing it. I want all of that to come back. But I think what we can learn is this hybrid way of learning, like working on a Peloton, in person, live streamed, and on demand. And this really is the live class of it with our instructors. So before we move on to the next topic, I just want to remind everyone, to get the most Nacho Nuts boost pricing, just text boost to 215-543-6454. Now, but next on my list, have Todd say something nice about me. Sure. Okay. So people have called me annoyingly likable. One of those people, my own wife. So you've known me for 3 years. Reached out to me. What are some of the things that I've helped you kind of get out of your comfort zone to do? And why would other dentists want to do something like that?
I mean, let's just go with the most obvious one because you know you're going to mention it anyway because you love to mention it every time we have a text conversation. So my associate, right?
Right. That's number one. Good. Your associate.
Golgi Kara, I absolutely adore her. She's incredible. And I hate to admit it, but I was fortunate to be introduced to her through you. And so, yeah, I mean, that's something that you can do for people. You're a connector, right? You're a conduit. I love that word. I use conduit a lot, right? And so you're a conduit to care. You're a conduit to education. You're a conduit to people. And so that's one thing you provided me. You know, from the very beginning when we first did some lectures together, you know, and I said, the more Paul annoys you, you'll be less annoyed, right? So
yes.
that continues to lay true.
My annoyance is out of kindness, and I'm glad I did it. And I love the Bulgy example is awesome because your life is better now that you do that, and you've gotten out of this comfort zone.
A lot better.
But then there's also just small wins, like the sweatshirts we're wearing. Why is branding important? One of our sponsors, A-Best, I said, Todd, you got to get their stuff. You did it. You're having fun with this branding. It's not about getting new patients, about your team feeling good. So just talk about branding as a dentist and how, even just these sweatshirts you're wearing, what has that done for you and your team?
It's so funny because, I've never pushed the marketing a lot. So I do all this sort of like underground guerrilla stuff. And like, I just wanted to make something for my team and for myself and for my friends and for my family because I want to represent us. So I did a TAF team crest, right? This is TAF team and this is the goat that's in Rittenhouse Square. And this is the love symbol that's here in Philadelphia. And this is our smile with the, like you said, I'm a big music fan. This is the Bowie bolt from like Ziggy Stardust. That was a sort of inspiration. And so that's a little bit behind the sweatshirt. And then, obviously you do a lot of that branding and I sort of like the idea of it. And, my practice is sort of word of mouth only, but at the same time, interestingly enough, like recently a bunch of specialists in town, they send us things for the holidays and they write, to the TAF team. Well, no one ever said the TAF team before 5 years ago when I started hashtagging, the TAF team, right? And so it's a slow burn. It's nothing that I really expect is going to have like great momentum necessarily, but I like the idea of just making sure that if you want to represent yourself, everything you do counts, right?
For sure.
And so when I made a sweatshirt for my friends and family and my coworkers and my team, I wanted it to feel good. I wanted it to look good. I wanted to be a representative of what, sort of the Fleischman office and Center City Philly Dentist and everything that we are, it counts as. And so it really does trickle down from the beginning, and you have to have a philosophy of care and a philosophy of practice that stays consistent.
Yeah. And also, Todd, one of the things, especially pandemic's never been more of a good experience. It's fun to be part of something fun. It's fun to be part of something, a team. You talk about you never walk alone from your soccer fans. I mean, whether it's Nachos, whether it's your dental office, whether it's something to do, I mean, we have so much division inside of dentistry and outside of dentistry that when you can be part of something fun, these are the things that don't show up on a stat sheet that I wish dentists would just explore more. And I'm glad you have. I mean, I think I'm even wearing the t-shirt, Todd, underneath, like a real concert.
I'm wearing a Nachos underneath.
Yeah. So we'll wrap up in about 5 or 10 minutes, but I do want a couple more things about me telling everyone kindly, I told you so for you. So it's okay if you get it through Jeff Goodman. You did this thing. I was like, Todd, your patients love what you do. You should share it more. I'm like, you should try this thing that helps people share it online. What is that thing you've tried that you're like, I'm so glad I did that people are reviewing you?
Swell?
Yeah, Swell. So how many reviews are you up to now?
I think I'm pushing 300.
And when you started Swell, how many did you have?
I mean, I think we both know the Big Bagel, right?
So. Yeah. So Todd has used Swell, one of our key resources and sponsors, to share the fun online of what he does. And I always say, I'm not joking. I use Swell for Nachos. Sometimes I read my own reviews when I'm feeling down just to make sure I increase my own morale. So getting those Swell's reviews, again, is that a morale boost for you and the team?
It is. I will say it very much is. I mean, it's the kind of thing that until you ask your patients, you're not going to know. And of course, they leave feeling good and they say things like, oh, this place is the best. And, I can't imagine going anywhere else or whatever it may be. But then you see them write something that they've obviously taken some thought and time to do, and then you share that with your team. Obviously, like the key is you have to make sure like these aren't getting lost in the in the ether,
Yeah.
right? Like if people are putting nice things out there, you have to share them. It takes effort. You have to print them out, put them on your team's desk, like put them in the break room, like show everyone this is what people are thinking. It perpetuates an attitude. It's a lot about this list behind us, right? It's like, what do we offer our patients so that they can write this kind of review on Swell? What's going to make us feel and look different to the experience they've had in the past? And how do we then get that message out there, right? Well, Swell, I mean, I'm obviously a brilliant salesperson and I'm doing your job for you, but Swell does that job, right? It puts it out there so that you can have other people hear and see the work that you're doing without you having to go out and be like,
And then
I'm the
what you're saying,
goat.
it lets them articulate in a way on their level, as opposed to just good job or this is great in the office. They can go home and write it. They often share a team member's name, which makes them feel great and say, oh, the hygienist, the front desk. And that's, I mean, dentistry, you can, you keep your sweating on the outside, you're crying on the inside during your dentistry day. We can sit back and talk about smile transformations and the impact, and that's awesome. But there's a lot of micro annoyances in a daily day. So when you have that, that's great. So we're going to finish up with this game, Todd, I'm going to surprise you with. It's going to be called Same or Better. So I'm going to say someone's name. So I know you like me at like 10 out of 10, but do you like this person the same as me or better? Okay.
Everything's compared to you?
Yeah, compared to me, right? So first name I have here.
Better.
Joe Latinelli.
Better.
Okay. So one of the things I do is bring people to you who you will like better than me, and that's hard. But just share through this pandemic,
You're a conduit. We've
had a text chain, but what does it mean to have dentists in your phone or in your life that you can go to with questions on it anytime and you know they'll answer them?
It's not just having them available, right? You need people to lean on anyway. That's just like, first of all, just talk about mental health to begin with, right? I mean, I'm a huge proponent of therapy. I'm a huge proponent of talking things out. I mean, I'm a sensitive dude to begin with. So like for me, to have people you can lean on, and by the way, people that you trust so much, that you're so close to in this group that we have, that even if you're annoyed by the things they say or you disagree with them completely or you want to call them shitheads, excuse me, or whatever, they still take it and we move on, right? Like if you don't all have to agree on the same thing to have support. That's not what support means. Support means that even if we disagree, we still care about each other. We still have a choice to lift each other up. And even if we're not making the same decisions, we can still be supportive, right? That's really important.
Emotional time. You sometimes circle back and say, man, I reacted strongly to this one thing, but it really made more sense than I thought. So let's say you're a dentist and you don't have this network and you say, I want to build it, right? What are some ways, some things I would say is interact more on social media in a fun way. What are some ways you think a dentist could build this network, especially during a pandemic?
I mean, I know you're a big social media guy and I respect it, and I am too, but I would say social media to be, as you well know, a little bit conscious of, because there are so many people coming from so many different angles that you can get a little bit wrapped up in if there's a negative choice, you might take it a bit personally. So social media is one option. I would say as a better option, and the option that I used before social media because we were older, is actual, and I know it's tougher during COVID, but it's going to end at some point, is the actual physicality of face-to-face meeting your colleagues, going to events, or actually sort of understanding who in your community do you already respect, whose work have you seen, what specialists do you think are doing fabulous work. Call them on the phone. Introduce yourself. Ask them how you might be able to learn from them. What can you show me? How can we find a way to develop a relationship? My closest specialists here in Philadelphia who I lean on significantly are also some of my best friends now, because you just can't help but develop a bond amongst each other when you're having a similar philosophy of care. It's just the way it goes.
I want to interrupt you for a second, because I think what you're saying is great. When I say social media, I think sometimes think of Dental Nachos Facebook group as the crazy Alves, a lot of stuff going on, but there's small restaurants. Go on Instagram and reach out to someone who's doing cool stuff.
There's so much information.
And that, when I say that's social media too. So I don't mean necessarily get into arguments about PFMs versus zirconia, but I'm saying you can use Instagram, and people like to be asked about, hey, how did you do a case like that? Or how did this work out for you? And I just think if we do more of that, that's awesome. So I'll wrap up.
I will say, I saw, just to interrupt, I saw a great post recently, by a really high level clinician, really next level, like the Michelangelo of dentistry. And he's like, I just want to have people stop asking me what I used here and ask me why I used it.
I like that.
Right. Yeah. And like, honestly, he's right. Like, it's not just about what composite he used, because I can guarantee I can use the same composite he uses and not get the same result he does, right?
Yeah.
And people can use the same ceramist I use. People always ask me, oh, who's your ceramist, Todd? That's great, but it won't matter who my ceramist is if you don't understand the theory, right?
For sure.
And so that's a big part of it.
I love that part of it. And, as we wrap up with mentoring, Miles has been such a great part of what we do. Manny from the boost camps, the Baljeets, and there's so many great people out there.
Brandon, yes, all the guys.
If you were 2 or 3 years out of school, like these guys, and they're doing great things, or these awesome female dentists too,
incredible.
What treatment plan would you give them to grow towards practice ownership? What are some things that you would have them do? Say, hey, these are some good steps for your checklist. And I can share some of my own. I mean, one of mine would be to consume as much about this topic as possible before you make the decision. It's not as easy as switching labs or changing your implant system. It's a once decision. And maybe you can even just kind of talk about your own experience of how you're sitting in that practice today to bring it full circle and what you did to get there.
Yeah, it's funny. I was talking about it with my hygienist yesterday. I don't even know how I'm sitting here. Sometimes you forget. Like 10 years ago seems like forever, by the way, and 10 and a half years at this point. And so honestly, you got to be able to jump off the ledge. Like there is going to be some scaries about it. You're never going to be 100% confident. But the key, I would say my key, just speaking personally, is surround yourself with good people.
Yeah.
I mean, you just can't be cheap about it. There are incredible talents out there, professional women and men and associates who can help lift you up, lift your brand, lift your approach toward care, but you're going to have to pay for it, right? And so that's part of it, is that don't be cheap. Don't try and have everything be as inexpensive as possible to try and save money. The goal is to invest in yourself the best way possible. I really didn't do any management CE before I owned the practice, which was probably a mistake, quite honestly. And if I was a young dentist now who was working his way, him or her way to ownership, I would think about doing some management CE. You can easily do that kind of stuff all over the place and just learn about ways of being a leader. Leadership is a huge part of it.
I love that. And you and I are both big fans. You've taken Kois, you've taken Spear, you've invested in yourself, but you also did that GPR. What was that value of doing a GPR from this? Let's finish. Dentists love clinical stuff. The prep design, this. What was that value of that GPR in your clinical life, that 1 year, and why was it so worth it, as opposed to just jumping right into private practice?
Yeah, so mine was really interesting because I was actually in an AEGD technically.
AEGD, same.
And the reason why that matters is because I wasn't hospital based, right? I was in a strip mall in South Jersey in what would have been a dental office, like anyone's dental office, right? And the beauty of that year was I was practicing four-handed dentistry, which we didn't do in dental school, right? And you're under the tutelage of attending doctors who are local specialists, typically, a couple of GPs, but local specialists. And so I learned a ton about endo and implantology and all the things that you don't learn in dental school. I also learned how to manage a patient the right way, how to manage a team member the right way, how to start to interact with team members appropriately, right? These are dynamics that will make a huge difference that are based on personality issues, right? And so it's not being a dentist certainly is being a clinician, right? It's being a tradesman. I always joke that dentistry is really just a trade, right? Like at the end of the day, we're fixing things from like a physical perspective, right? It's physics in there, but it's so much more than that trade because we're not plumbers who can go and work by ourselves in a toilet and call it a day, which is hugely important and wildly successful plumbers. I know plenty of them, but we are people who interact with patients. Right?
Well, I would say this is my best talking tip when patients are acting crazy, which is often. If you could drop your mouth off like your car, it'd be easier for both of us. And then they laugh. Because
what a brilliant statement.
You can't say, I said to this woman the other day, I said, I can't be like, hey, Jennifer, I'm too tired to work on you right now. Go see if we have the parts. I'm going to go eat lunch. It's all 6 inches away, full contact arts and crafts. And that feeling, if you're not confident in what you're doing clinically, doesn't mean you can't learn. But that's why that's that magical time to enhance those skills in a supportive environment.
Young dentists also need to understand they need to communicate to patients so that they can set expectations. I did a number 15 the other day on a friend of mine who's a decent patient. It still felt very challenging to me. I've probably done 1,000 number 15s in my career already. And I specifically set him up ahead of time. I go, this is a very challenging tooth. I'm going to need your help when we're doing it. You only can open so far. How can you expect me to do this work as best as I can with you like this?
Yeah, I know, right. I always say, do you not know how words work? Like it's open, like, I say to adults, open like an alligator. I say it to a real adult because at
Have
least
to take control of the scenario, and that's something that young dentists aren't capable of doing because they don't know how, right? Those are things that we could teach them potentially so they could save a lot of heartache. That's true.
I love that. Well, we'll wrap up with that, Todd. Hang on, I'll ask a few questions, but to be in the drawing for a sweatshirt, just text TAF to 215-543-6454 with your
Who wants one
sweatshirt.
of these bad boys?
Yeah.
They're soft like butter.
Do not miss out on this boost chance. This is a live thing. There may be no recordings. I may take the recordings, put them right in my pocket. Show up for the course. Block out your schedule. You will not regret blocking out a day of work. You can produce the next day. You're going to see awesome clinicians.
We also want interaction. The whole point of this process is to engage each other.
Yes.
If you see a case that I'm doing, me specifically, quite honestly, I want people to tune in for me. I really want to show people the work that we're doing. Ask a question
like real life. Todd's going to be on Zoom, ask a question. So you can take us off Facebook Live. We'll stay on Zoom and answer a few questions, Todd. But thanks so much, Nacho Verse. Join us for Super Dentist Boost. Todd, thanks as always for being you.
My pleasure.